Good evening, everyone. My name is Sherisen Lopez. I am a student of Cebu Technological University Danao campus. I am taking up Bachelor's of Secondary Education, major in English, Wednesday evening. I am here today to assess my idea on one of the tweets of Boris Johnson, which I am going to talk about the COVID-19 vaccination. As we all know, the COVID 19 outbreak is one of the global crises that we are all fighting with. And there's no doubt that this illness has an impact on people's life. Just as we thought the 6 month break would be temporary and that we would be able to resume our normal lives afterward, we had no idea that this was the start of a period in which our normal and regular routine would be paused for years. This coronavirus disease is caused by a novel coronavirus called Severe Acute Respiratory Syndrome Coronavirus 2 or SARS-CoV-2, which was first identified amid an outbreak of respiratory illness cases in Wuhan City, Hubei province of China. This disease is caused by a virus and not by bacteria, and it was initially reported to the World Health Organization or WHO on December 31, 2019, and on January 30, 2020, the WHO declared the COVID-19 outbreak as a global health emergency. COVID-19 affects our social and economic crisis just as much as it is in our health. Its repercussions, severe and far-reaching, are being felt across the entire world. Prime Minister Boris Johnson posted a statement on his Twitter account about the pandemic. COVID-19 is still out there. The disease remains a risk. But I'm confident we can keep going with our plan and protect the gains we have made together. I encourage anyone who has yet to have a vaccine to do so, he wrote. COVID-19 vaccinations have been approved after being tested in clinical trials and proving that the vaccine considerably reduces the risk of contracting the virus. Even if you do get the virus, the COVID-19 vaccine, based on what has been proven about vaccines for other diseases, may help us keep from becoming really ill. So getting vaccinated may help protect individuals close to us, such as our families, our friends, and our loved ones, especially those who are at higher risk of serious COVID illness. I am proud to say that I am fully vaccinated, and I will admit that there have been times when I was afraid not of the injection, but of how my body would react if I did get the vaccine. I also had second thoughts and doubts, but I really encourage myself to do so because it is for my own protection and the protection for those around me. We all want to return to our normal lives, or the new normal as we call it. Stopping a pandemic requires taking all available precautions, such as wearing masks and avoiding close contact with others. These measures will help us reduce the risk of being exposed to the virus or spreading it to others. But they are not enough. Vaccines work with your immune system to ensure that if you are exposed to the virus, your body will be prepared to fight it. As a result, the greatest solution is to prevent this harm from happening by using tests, treatments, and vaccines wherever they are needed. The vaccine is the last step in our effort to not only protect ourselves but also to return to the lives we all love and miss. As more people receive the vaccine, we may achieve herd immunity, which means the virus will be less likely to spread. To assist us reach this public health goal, it's important that we all get vaccinated.